My name is Pat Olson, and I'm the Health Services Director for Portage Township Schools. Today I'm here with Dawn Mosslander, the nurse from Willow Creek, and Dawn Harbarth, the nurse from Fagley. We're here to talk to you about first aid and the ever-fashionable fanny pack that you can take out with you for field trips. One of the most important things to remember before a field trip is that you turn in a list to the clinic at your school at least 1 to 2 weeks in advance. That gives us a chance to have all the medications and supplies you may need while on your trip, as well as to make arrangements for staff to go if it's needed. First, I'd like to show you what we include in our fanny pack. We keep gloves, which you should always use if you're dealing with blood or bodily fluids. We have wipes for cleaning scrapes and cuts. We have antibiotic ointment to apply to those cuts and scrapes, and various size band-aids depending on what you need. We also have larger gauze squares for cuts that are of a bigger size that we'll talk about later. We have cold packs. We have sting kill swabs. We have Benadryl, and we have an asthma inhaler. Also, you'll find in the fanny pack cards with directions for each of the emergencies that we're going to talk about today. So the first emergency we'd like to talk to you about today are head injuries. So Dawn will talk to you about that.
For head injuries, if you have a child that bumps their head, first thing you do is apply an ice pack and then ask them some questions. Ask if they have a headache, if they feel dizzy, if their vision is blurry, or if they have an upset stomach. And ask them what their name is and where you are. If they have several of these symptoms and they begin to be worsening, you need to call 911. And then John is going to talk about severe cuts.
So the first thing you do is you put on gloves, apply gauze squares, and pressure to the wound. If the cut bleeds through the gauze, continue to add more gauze to the top of that and continue to apply pressure. Elevate the injury to slow breathing and call for emergency help if needed. At this time, Pat's going to talk about seizures.
If a student is having a seizure, if they're not already on the ground, try to get them there. If possible, put them on their side because sometimes there's some excess saliva or even vomiting can occur during a seizure. The only thing you can do is protect their head at this point. You can either hold it with your hands or put something soft like a jacket underneath. You want to specifically note the time that the seizure started because this will make a difference in deciding whether you need emergency help or not. The school's protocol is to allow the student to continue to seize for up to 5 minutes without 911. But 5 minutes on a field trip is going to feel like an eternity. So if after a minute or so you're not comfortable continuing to watch this, go ahead and call 911. Just maintain the student's privacy while you're waiting because sometimes there are things such as loss of bladder control as well. If they have a seizure that's short and they feel fine after they come out of it, let them rest for a little bit and then they can continue their trip. But I would also have them call their parent if that's possible to let them know that it occurred, or you can call back to the school and the nurse from the school will call and let the parent know that it occurred. If the seizure lasts 5 minutes or longer, or they have one seizure after another, or they have no history of a seizure, that's when you would want to call 911. Otherwise, like I said, you can call the school and we can notify the parent for you if the seizure was short. Next, Dawn's going to talk to you about asthma.
If you have a child that is known to have asthma and they're having trouble breathing, the first thing you do is encourage them to remain calm and to breathe slowly. Having them get a drink of water and talk to you will help with that. Have them use their inhaler. You take one puff, wait 1 to 2 minutes, and use another if need be. If they do not have their inhaler with them, you'll have an inhaler from the clinic in your fanny pack. If they are continuing to have trouble breathing, then you should call 911. And John is going to talk about diabetic reactions.
If students are elementary or middle school and a family member is unable to attend the field trip, a medical person from the school will accompany the student. Most often, a diabetic reaction is more obvious when the blood sugar drops below 80. Symptoms that you may see are shakiness, headache, pale coloring, mood changes, weakness. The first thing the student should do is check their blood sugar. If it is below 80, treatment is a fast-acting sugar such as a small cup of juice, half cup of regular pop, glucose tabs. If that is not available, there is a tube of cake frosting in the fanny pack that can be used. Be sure that you follow up with a snack that contains protein and carbs. And if unconscious, call 911. Pat's going to talk to you about severe allergic reactions.
I just want to talk to you about the severe allergic reaction in the sense that it can be either a bee sting allergy or it can be a severe food allergy such as peanuts. But for today, we're going to talk to you as if it's a bee sting allergy. So when a student normally gets stung, you would notice localized redness and swelling. At that time, you can take out one of the bee sting swabs that's in the kit. You push it through the cardboard, you squeeze it until you get all the green liquid down on the tip, and then you apply this to the area. It just is a little bit of a numbing agent. Then you can follow that with the ice pack and watch the student for 15 to 20 minutes. If they have no further symptoms, then they're free to go on with the trip. If the student is listed as having an allergy on the list that you have, then you would administer whatever treatment is listed there. Do not wait for symptoms to occur. We want to show you a little bit though about what would happen if they start to develop severe reactions. The types of things that you may see are choking sensation or difficulty swallowing, or they may hold their throat. They may develop chest tightness or wheezing like an asthmatic. They may get a generalized rash or hives, which means the rash is all over the body, not just where they got stung. They may get tingling of their lips and tongue and get a light pale bluish color around their lips. They may get swollen or puffy eyes. They may get extremely anxious, the kind where it seems like they're going to come out of their skin, not just a little bit nervous. Or they also may go into shock. If this occurs and the student has no known allergy, give them the Benadryl and call 911 right away. If it's a student with a known allergy, they will have an EpiPen with them. We're going to demonstrate to you how to use that EpiPen so that if the student needs help, you're able to do that. We have in a yellow box is the adult or the older student strength, and then we have EpiPen juniors, and that would be clear on the prescription what the student gets. These come in twin packs, and we'll explain how those are used in just a couple of minutes, but this is what they look like just so you know what the real thing looks like. And you would just open the tube and remove the EpiPen when you're ready to use it. So for the training purposes, we have a trainer so that we don't have to use the real thing. And just remember, always on the side of the EpiPens, it gives you step-by-step instructions if you ever forget what we're doing. So the first thing you want to do normally is you would have the student sit down because you're going to put this into the thigh. We're going to have Dawn stand up today so you can see what we're doing. You're going to remove the cap. You wrap your hand around the barrel of the EpiPen. You're going to give it on the upper outer thigh with a little bit of a swinging motion, just like that. You don't have to harpoon the kids, just a slight swing. You'll hear that click. You want to count to 10 slowly, and then you'll remove the EpiPen. There's an orange cover that comes back out and it keeps the needle covered. Put it back in the box and bring it back to us and we'll dispose of it for you. Once you've administered the EpiPen, you want to follow that up with a dose of Benadryl that will be in the pack. And while you're doing this whole thing, if you have another adult with you, have them calling 911. If there's no one else with you, administer the treatment, take the child with you, and you call 911. Remember, EpiPens are only a temporary fix, so the symptoms will return, so make sure 911 is always called. That's extremely important. There is a new product that's on the market called Aviq. It has the same type of medication, but it's administered the same, but it talks to you and will tell you exactly what to do. So you work it the same way. You're going to pull it from its container.
This trainer contains no needle or drug.
Now it will tell you what to do.
To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds. 5, 4, 3, 2, 1. Injection complete.
So that's kind of helpful for you when you're nervous,
This
but
trainer
not
may be
everybody has
reused
those.
for training
So just to
replace the
reiterate
red safety guard
briefly,
and gray outer case.
if they develop those symptoms and
This
You
trainer
have
may be
their EpiPen with them. You're going to administer it. You're going to always follow up with Benadryl, and you're going to always call 911. Some people ask exactly where they should give it when we just say upper outer thigh. So I would just tell you between the crease and the seam of your pants towards the top of the thigh is where that large muscle group is. So it's EpiPen, Benadryl, 911. And once the paramedics get there, they'll take over treatment for you. So we hope this has been helpful to you today on any of the emergency medical situations that could come up on your field trip. If you have any questions after watching the video, please feel free to call any of us and we'll try to answer those for you. Remember as well that when you finish watching this, you need to mark that you've watched the video. Then the first time you check out one, we'll have you use the EpiPen trainer to make sure you're comfortable with using it, and then you'll be ready to go. So we hope you have a great school year.